Welcome to the Discourse Analyzer AI Toolkit, where articles come alive. You're listening to the audio version of our article. For the full text and an interactive experience, check out the link in the description below. Interact with any selection using our AI assistant to enhance your understanding. Let's explore.
Patient-provider interactions in discourse analysis. Patient-provider interactions are the communicative exchanges that occur between healthcare professionals, providers, and patients during medical consultations, treatments, or routine checkups. In discourse analysis, these interactions are studied to understand how language shapes the dynamics of healthcare, influencing diagnosis, treatment, patient satisfaction, and the overall quality of care. Discourse analysis in this context examines how communication reflects and negotiates roles, power dynamics, empathy, and trust in medical settings. The language used in patient-provider interactions plays a crucial role in determining how information is exchanged, how decisions are made, and how patients understand their medical conditions. By analyzing these interactions, researchers can explore how linguistic features such as questioning, advice-giving, and narrative construction influence the relationship between healthcare professionals and patients, affecting outcomes like patient adherence to treatments and their overall satisfaction with care. Key features of patient-provider interactions in discourse analysis. Point 1. Power dynamics and authority. In patient-provider interactions, there is often an inherent power imbalance, with the provider typically holding more authority due to their medical expertise. Discourse analysis examines how this power dynamic is negotiated through language, whether the provider dominates the conversation, how much agency the patient is given, and whether the interaction is collaborative or paternalistic. Example: in a medical consultation, a provider might use technical language and limit the patient's speaking time, reinforcing the provider's authority and controlling the flow of information. Discourse analysis would focus on how the provider's language choices shape the power dynamic and how these choices impact the patient's ability to participate in decision-making. Point 2. Questioning and turn-taking. Questioning is a central aspect of patient-provider interactions, as providers often ask questions to gather information, while patients ask questions to seek clarification. The types of questions asked and how they are structured, open-ended versus closed-ended, influence the depth of the patient's responses and the quality of the interaction. Turn-taking also reveals how both parties manage the flow of conversation and share control over the interaction. Example: a provider may ask, "How have you been feeling recently?" an open-ended question, rather than, "Are you feeling any pain?" a closed-ended question. Discourse analysis would explore how open-ended questions encourage patients to share more information, fostering a more patient-centered approach, while closed-ended questions might limit the interaction and focus on specific aspects of the patient's condition. Point 3. Narrative construction. Patients often use narratives to describe their symptoms, experiences, and concerns. Providers, in turn, may reframe or summarize these narratives to arrive at a diagnosis or treatment plan. Discourse analysis examines how patient narratives are constructed and how providers interpret or reshape these narratives to align with medical knowledge. Example: a patient might describe their symptoms using a detailed story about when and how the pain began. A provider might then reframe the narrative by focusing on clinical details. "It sounds like the pain started 2 weeks ago and worsens when you move your shoulder." Discourse analysis would investigate how the provider reshapes the patient's experience into medically relevant information while potentially downplaying emotional or contextual details. Point 4. Empathy and rapport building. Language plays a key role in expressing empathy and building rapport between providers and patients. Empathetic communication can foster trust and make patients feel understood and supported. Discourse analysis looks at how language is used to convey empathy, through verbal expressions of understanding, acknowledgement of patient concerns, and emotional support. Example: a provider might say, "I understand how difficult this must be for you, and we're going to do everything we can to help," to acknowledge the patient's emotional state. Discourse analysis would focus on how such statements contribute to building a positive relationship and improving patient satisfaction with care. Point 5. Shared decision-making. Shared decision-making involves both the patient and provider collaborating on treatment decisions. In this model, the provider offers medical expertise, while the patient contributes their values, preferences, and personal experience. Discourse analysis examines how language facilitates or hinders this collaborative process. Example: a provider might say, "There are a few different treatment options available, and I'd like to discuss them with you so we can choose the one that works best for your lifestyle." Discourse analysis would explore how this language encourages patient participation and empowerment, as opposed to more directive approaches where the provider solely recommends a treatment. Point 6. Medical jargon versus lay language. The use of medical jargon by healthcare providers can create barriers to understanding for patients. Discourse analysis investigates how providers balance the use of technical language with lay explanations and how this affects patient comprehension and engagement. Example: a provider might explain a condition using jargon, saying, "You have a meniscal tear in your knee," but then follow up with, "This means the cartilage in your knee has been damaged, and it's causing the pain." Discourse analysis would focus on how the provider navigates between technical language and lay explanations, ensuring the patient understands their condition and treatment options. Point 7. Directive versus facilitative communication. Providers often adopt either directive or facilitative communication styles. A directive style involves giving explicit instructions or advice, while a facilitative style encourages patients to share their thoughts and preferences. Discourse analysis looks at how these styles impact the interaction and patient outcomes. Example: a provider using a directive style might say, "You need to take this medication twice a day," while a facilitative approach would involve asking, "How do you feel about starting this medication, and do you have any concerns about taking it?" Discourse analysis would explore how these different approaches affect the patient's sense of agency and adherence to treatment. Methods for analyzing patient-provider interactions in discourse analysis. Point 1. Conversation analysis. Conversation analysis is a method used to examine the structure and patterns of interaction in patient-provider conversations. It focuses on turn-taking, sequences of questions and answers, and how participants manage topics and transitions in conversation. Example: a conversation analysis of a medical consultation might reveal how a provider frequently interrupts the patient, limiting the patient's ability to fully express their concerns. The analysis would investigate how these interruptions shape the interaction and potentially diminish the patient's involvement in decision-making. Point 2. Critical discourse analysis, CDA. Critical discourse analysis, CDA, explores how power relations and institutional norms influence patient-provider interactions. CDA looks at how language reflects the medical hierarchy, patient agency, and broader social issues such as inequality in healthcare. Example: a CDA of interactions between healthcare providers and marginalized patients, such as those from racial or ethnic minority groups, might reveal how institutional biases and power imbalances affect communication, with providers speaking in a more authoritative tone and patients being less likely to ask questions or challenge medical decisions. Point 3. Thematic analysis. Thematic analysis focuses on identifying recurring themes in patient-provider interactions, such as trust, empathy, authority, or patient autonomy. This method helps explore the underlying values and assumptions that guide communication in medical settings. Example: a thematic analysis of provider-patient interactions might focus on the theme of patient empowerment by examining how often providers encourage patients to ask questions, express concerns, or participate in decision-making. The analysis would reveal how language either supports or undermines patient empowerment. Point 4. Narrative analysis. Narrative analysis examines how patients and providers construct and interpret stories about illness, treatment, and recovery. It focuses on how these narratives shape the understanding of health and illness and how they contribute to the therapeutic process. Example: a narrative analysis of chronic illness consultations might reveal how patients frame their experience in terms of ongoing struggle, while providers might frame it as a condition that can be managed with the right treatment plan. The analysis would explore how these different narratives affect the interaction and the patient's sense of control over their illness. Examples of patient-provider interactions in discourse analysis. Example 1. Empathy in oncology consultations. In oncology consultations, providers often need to deliver difficult news while maintaining empathy and supporting the patient emotionally. Discourse analysis of these interactions would focus on how providers use empathetic language, such as, "I understand this is overwhelming," or, "We're here for you throughout this process," to acknowledge the patient's emotional state. The analysis would explore how these expressions of empathy contribute to building trust and improving patient satisfaction with care. Example 2. Power dynamics in mental health care. In mental health consultations, there can be a tension between provider authority and patient autonomy, especially when discussing treatment options such as medication or therapy. Discourse analysis might reveal how providers assert their authority through the use of technical language or advice giving, while patients may struggle to express their preferences or concerns. The analysis would investigate how power is negotiated in these interactions and how it affects patient outcomes, such as adherence to treatment. Example 3. Shared decision-making in chronic disease management. In managing chronic diseases like diabetes, shared decision-making is crucial for aligning treatment plans with the patient's lifestyle and preferences. Discourse analysis would examine how providers frame treatment options, using language like, "Here are a few ways we could approach this, but I'd like to know what you think works best for you." The analysis would explore how this language fosters a collaborative relationship and increases the patient's engagement in managing their condition. Example 4. Medical jargon in emergency room consultations. In emergency room settings, providers often use medical jargon to communicate quickly and efficiently. Discourse analysis of emergency room interactions would focus on how providers balance the need for speed with ensuring patient understanding. For example, a provider might say, "We're going to run a CBC to check your white blood cell count," and then follow up with, "That will help us see if there's any infection." The analysis would examine how patients respond to the use of jargon and whether follow-up explanations are sufficient to bridge the communication gap. Challenges in analyzing patient-provider interactions through discourse. Point 1. Time constraints. In many healthcare settings, time is limited, which can affect the depth of patient-provider communication. Discourse analysts must consider how time pressures influence the language used and whether these constraints lead to more directive or less empathetic communication. Point 2. Cultural and linguistic differences. Patients and providers often come from different cultural and linguistic backgrounds, which can lead to miscommunication or misunderstanding. Discourse analysts must be sensitive to these differences when analyzing patient-provider interactions and consider how language barriers or cultural expectations shape the interaction. 3. Power imbalances. The inherent power imbalance in healthcare settings can make it difficult to achieve true patient-centered care. Discourse analysts must carefully examine how power dynamics are reflected in language and how they influence patient engagement and autonomy. Conclusion. Patient-provider interactions are crucial for delivering effective and compassionate healthcare, and discourse analysis provides valuable insights into how language shapes these interactions. By examining power dynamics, questioning techniques, narrative construction, and empathy, discourse analysis reveals the complexities of communication in healthcare settings. Whether analyzing shared decision-making, the use of medical jargon, or the expression of empathy, discourse analysis helps identify how language influences patient satisfaction, trust, and health outcomes. Through this lens, researchers can better understand how to improve communication between patients and providers, ultimately enhancing the quality of care. Frequently asked questions. What are patient-provider interactions in discourse analysis? Patient-provider interactions refer to the communication exchanges between healthcare professionals, providers, and patients during medical consultations or treatments. In discourse analysis, these interactions are studied to understand how language affects healthcare dynamics, including diagnosis, treatment decisions, and patient satisfaction. How do power dynamics manifest in patient-provider communication? Power imbalances are common in patient-provider interactions, with providers typically holding more authority due to their medical expertise. Discourse analysis examines how this dynamic is reflected in language, whether providers dominate conversations, how much agency patients are given, and whether communication is paternalistic or collaborative. What is the role of questioning in patient-provider interactions? Questioning is central to gathering information and clarifying medical issues. Providers may use open-ended questions to encourage patients to share more detailed responses or closed-ended questions for specific information. Discourse analysis investigates how questioning styles impact the depth of the interaction and patient involvement in their care. How does narrative construction affect patient-provider interactions? Patients often describe their symptoms through personal narratives, which providers may reframe into medical terms. Discourse analysis looks at how these narratives are shaped and interpreted, exploring how providers extract medically relevant details while sometimes downplaying emotional or contextual factors. What role does empathy play in patient-provider communication? Empathy is crucial for building trust and rapport. Discourse analysis examines how empathetic language, such as acknowledging patient emotions and concerns, improves patient satisfaction and trust in the provider. It focuses on verbal expressions that convey understanding and support. How does shared decision-making feature in these interactions? Shared decision-making involves collaborative discussion between patients and providers about treatment options. Discourse analysis explores how language encourages patient participation, with providers framing options in ways that invite patient input, enhancing empowerment and adherence to treatment. How does medical jargon impact patient-provider communication? The use of medical jargon can create barriers to understanding. Discourse analysis studies how providers balance technical language with lay explanations to ensure patient comprehension and engagement, focusing on how this impacts patient satisfaction and decision-making. What is the difference between directive and facilitative communication? Directive communication involves giving explicit instructions, while facilitative communication encourages patient input and autonomy. Discourse analysis examines how these approaches affect patient participation, with facilitative styles often leading to greater patient satisfaction and involvement. How does conversation analysis apply to patient-provider interactions? Conversation analysis focuses on the structure of communication, such as turn-taking and topic management. In patient-provider interactions, it looks at how interruptions, question sequences, and transitions affect the flow of information and patient engagement. What are the challenges in analyzing patient-provider interactions through discourse? Challenges include accounting for time constraints that can limit communication depth, cultural and linguistic differences that may lead to miscommunication, and inherent power imbalances that impact the interaction. Discourse analysis must navigate these complexities to provide a comprehensive understanding of communication in healthcare settings.